Hi, I'm Jacqui Felgate, and a very warm welcome to Luke Darcy, Joe Stanley and Dr. Nick Carr. Hello.
Good to see you, Jack.
Here at the House of Wellness, we are all about Australian medical marvels, amongst other cool things, and today is no exception. We're amongst the best in the world.
And Jack, the innovations are coming thick and fast. The bionic ear, the cervical cancer vaccine, spray on skin, they're all remarkable Australian inventions. And Australia's leading the way again, this time with the first ever artificial heart.
And I guess it was only a matter of time, Dr. Nick, but this is going to allow so many more people access to life-saving transplants.
Yeah, it's a really, really important change, Joe, because around the world, millions of people suffer from heart failure. Only a tiny percentage ever get the transplant that they need because, sadly, many die before a suitable donor becomes available. So this is something which this Aussie-designed artificial heart hopes will change.
Well, we've got a lot to get through, so let's kick it off at the Peter Doherty Institute and an amazing medical marvel involving an autoimmune skin condition.
T cells are a specialised type of immune cell that can fight infections and cancers. In our research, we found that there was almost two flavours of T cells in the skin, pathogenic and protective. When I say protective T cells, these are the ones that fight our cancer and our infections. But these pathological T cells, they're the ones that are really implicated in autoimmune disorders, which means they don't have the correct reaction for that threat. And for a very long time, people treated these T cells as one population of cells. It wasn't really distinguished what was good and what was bad. But what we did is we used a lot of high-dimensional methods that were able to distinguish the genes and the proteins that make a pathogenic and a protective T cell different. With our research, we're really hoping that we can start to pinpoint, fine-tune how we delete a really bad T cell from a good one, so keeping the person healthy otherwise, whilst treating their autoimmune disorder at the same time. T cells, they can sense a threat. So when something is not right, there are signals around them that tell them it's go time. And so when there's a bug, some sort of germs or some sort of cancerous cell, the other immune cells in the body can signal like a little red flag to the T cells and say this needs to be destroyed. However, in the case of autoimmunity, it's a little different because the threat itself is part of our body. So we don't actually want to eliminate that altogether. What we want to do is just control the immune response to that threat. The research that we've done really aims to help autoimmune conditions like psoriasis, vitiligo, and alopecia. At the moment, these particular autoimmune disorders may be treated with similar types of therapies, including steroids. It's a very common drug, but unfortunately for these patients, it's a lifelong treatment, so there's no cure. And so what we're trying to do is we're trying to understand, well, what makes these T cells good and bad in every circumstance, and using our knowledge of the molecules that switch these cells on and off, we can customize and fine-tune these treatments for a given disease. I think it's one of the most exciting feelings when you find a discovery that no one else has found and you're then able to publish this work and get it out into the world, and we hope that this is a powerful resource for everyone else to really build upon, including ourselves, and get to the treatments that we need.
Tell what I love there, guys, seeing scientists genuinely excited about their own innovations and their own work. It's brilliant. And technology is changing our lives on an everyday basis, whether we like it or not. I think how reliant I am now on Google Maps. I literally can't get home without Google Maps. My sense of direction's completely gone.
I couldn't survive without the Bomb Weather app. I am on that app at least twice a day, sometimes 3 times, just to know. I want to know what's happening with the weather, even though I'm in it. I can feel it.
They've got to get it right.
Oh, that's all right. Maybe that's why I keep going back.
Yeah.
But apps are also revolutionising healthcare. We've got apps like Hot Docs, which tracks GP appointments. And we've also got apps for pretty much every aspect of health, helping you quit smoking, tracking your exercise, heart, blood pressure, even mental health. It's incredible.
And this is another area, Dr. Nick, where Australia is really leading the way, this time in regards to epilepsy.
Yeah, Jack, because about 250,000 Australians suffer from epilepsy, which causes recurrent seizures. And it's the unpredictable nature of those seizures that makes life so challenging.
And now a Melbourne young gun has helped develop a life-changing new app that allows people with epilepsy to manage and monitor their seizures.
Not knowing when a seizure might happen is difficult. The analogy that I use is that it's like having the stove on at home. It's just this level of awareness that you always have to have whenever you're out and about, whenever you're doing something that other people don't have to have. It's like this responsibility that is always with you. I have had to cancel travel plans in the past. I've had to cancel events in the past because you don't know when a seizure is going to happen. You don't know what week is going to be bad, what day is going to be bad, and it'll happen, and it doesn't matter what's happening that day. That's the day you're going to have a seizure, and you will have to cancel what's happening that day.
For uncontrolled epilepsy sufferers like Jacqui, unfortunately there's no crystal ball to reveal when seizures are going to occur. But new research from the University of Melbourne has resulted in the next best thing.
We all know about circadian or daily rhythms that govern everything in our body, from when we sleep and feel hungry and so on. And it turns out that we might also have these longer rhythms across many days, and it is governing seizure risk in people with epilepsy.
By analysing the brain activity, heart rates and seizure diaries of thousands of patients, biomedical engineer Dr. Pip Caroli has found that seizures aren't so unpredictable after all. In fact, with enough information, they can be forecast just like the weather.
We're really at the tip of the iceberg in understanding which factors affect these longer rhythms of people's seizures. The involvement of heart rate suggests there's some autonomic activation or stress that plays an important role, but many other factors from sleep to diet to hormones may also affect longer cycles. The main finding of our research into seizure cycles has been that they're very common for people with epilepsy of all ages, of all different types of epilepsy. However, they're very individual and specific to each person. So everyone will have a slightly different seizure cycle. So you really need personalised data to be able to build up a pattern of their seizures and generate a forecast for them.
With this in mind, Pip has worked with medical technology company Seer to develop a life-changing new app.
People with epilepsy use the app to input data about their seizures, other triggers and other kinds of data that all go into informing their future seizure risk. From there, they are able to visualise future days, hours, or even periods up to weeks and months in advance when they're at higher and lower risk of seizures.
Once I started putting in more seizures, I certainly started to see it linking up in terms of like, this is a bad 4 days or this is a bad 5 days, and then that would be like kind of when I have a cluster of seizures, and that's when I'll make sure I'm working from home so that if I have any seizures, I'm at home and I can still do my work and be safe.
It's been 22 years since the horrific Bali bombings, an event that Australia will never forget. And the tragedy brought together so many people, including some amazing medical minds.
One of them is Adelaide surgeon John Greenwood. He helped treat Bali survivors and then went straight to work further developing an artificial skin for burns victims.
Yeah, because Dr. Greenwood was unaware that working just a few floors below in the same hospital was another brilliant medical mind working in a different breakthrough in diabetes.
The two doctors met, and the result is an artificial skin that's now being used to treat type 1 diabetes.
A cure for type 1 diabetes could be around the corner, but it won't come in the familiar form of a pill or an injection. Instead, it's the surprising result of a medical journey that began in 2002 at Royal Adelaide Hospital, when world-leading burns surgeon Dr. John Greenwood found himself treating victims of the Bali bombings.
The main thing that we found regarding the Bali bombings was that the sheer volume of burn cases meant that the normal way that we treat patients, immediate burn excision and very rapid closure, couldn't be achieved. So what I decided after the Bali bombings was that we needed a way or a material that we could use so that when we removed burns immediately, we could temporise the wound.
Dr. Greenwood spent the next decade developing a game-changing artificial skin product designed to eliminate the need for skin grafts and reduce the risk of infection in serious burns cases.
There were a proportion of burn injuries that couldn't survive, irrespective of what we did. And it began to be apparent that with the BTM material, I could save the life of burns patients of any size, including one one patient with a 95% full thickness burn. And that kind of realisation gives you an enormous relief.
But while Dr. Greenwood was revolutionising burns treatments,
I mean, Jess, nice to see you.
Thank you.
in the very same hospital, Dr. Toby Coates was investigating new ways to control type 1 diabetes.
I didn't know him, of course, because he was 4 floors above me, and I don't leave the burns unit, and he doesn't leave the renal unit, so we never met.
That finally changed one fateful day in 2015, when Dr. Coates witnessed Dr. Greenwood giving a presentation on his latest research.
There was one slide that he showed which just was exactly what we've been looking for. So it was like one of those eureka moments when I thought, hang on, this is actually what the field has been looking for the last 15 or 20 years. And here it is, sitting in the burns unit 4 floors down from where I work. So that was really the moment that I thought, hang on, we need to do something about this. And that's when we started the collaboration.
By combining their separate areas of expertise, the two doctors have suddenly found themselves on the path to conquering type 1 diabetes. The unique treatment they've spent the past few years developing involves implanting a small patch of artificial skin into a patient's upper arm. The artificial skin stimulates high blood flow, creating a similar environment to a person's pancreas, which is then injected with insulin-producing cells. Once refined, the procedure could put a permanent end to insulin injections.
This could be done easily in a GP practice under local anaesthetic. So, we're trying to create something that's easy to do, easy to monitor, easy to remove, but leaving a tangible and long-term, hopefully lifelong, treatment for type 1 diabetes.
Last year, primary school principal Alec Tibbetts became the very first diabetic to undergo a trial of the new treatment.
I'm proud to be the first. I do feel quite lucky because I know there were thousands of people that would have put their hand up. My daughter is a type 1 diabetic as well, and when my daughter is cured, I want her to know that her dad was a part of that.
While Alec can't throw away his needles just yet, the results from his 3-month trial suggest it's only a matter of time.
At the moment, I'm on about 1/3 of the insulin that I was before. And my hemoglobin A1C, which is a long-term measure of blood glucose control, is now the same as a non-diabetic.
Look, we're extremely happy, to be honest. To go from bench to bedside like this in your career, nobody gets to do that. It's an absolutely fantastic thing to develop something completely new for the first time. And then for it to work the first time and work so well, we're very, very pleased.
Sometimes the best ideas are synergies between clinicians in particular or researchers of different fields coming together to have an idea and then taking that idea to a realisation. And the realisation in this case is if you can do what we've done in the first patient and have the result we've got at 3 months, what you have is a cure or a treatment for diabetes that's just not been optimised yet.
Amazing advances there, and anything that reduces the need for daily injections and needles has to be a good thing, right, Darcy?
Well, actually not too bad with a needle,
really?
Nick, but a rational fear of snake bites. Have I told you about that? I am terrified of snakes.
So I'm tipping that the universal anti-venom vaccine for snake bite is going to be a good thing for you.
Absolutely. Cannot come quick enough for me, Dr. Nick. And while scientists around the globe are researching a universal antivenom, as you said, a bit closer to home, you and a number of your GP colleagues understand are involved in a study around the link between taking aspirin and potentially reducing the risk of stroke. Is that right?
Yeah, so low-dose aspirin has been used for years for prevention for all sorts of things, particularly stroke in older people. And I was lucky enough to be part of a study led by Monash University. It yielded some pretty surprising results. Well, today it's my absolute privilege to be sitting in this beautiful garden here at Melbourne University with Professor Jeffrey Donnan. Jeffrey, welcome to the show.
Thank you, Nick. It's a pleasure to be here.
Now, first up, can you just tell us what your area of expertise is?
Well, I'm a neurologist over at the Royal Melbourne Hospital, and I've been researching stroke for most of my career.
So stroke is really your prime interest, isn't it?
My prime interest is stroke.
Now, let's talk about the Aspirin study. Tell me what that was all about.
Well, we have aspirin almost everywhere in society, and the big question is, should we take aspirin to prevent people who are normally healthy over the age of 70 having heart attacks and strokes. And that was the purpose of the whole study.
So this was a huge study, wasn't it? It was 19,000 people, and it was aspirin versus placebo to see if it helped.
That's right. What we wanted to know was look at the risk-benefit, because we know that there's a potential benefit, but we also know there was a potential risk. Which was going to win?
And in a nutshell, what did we find?
Well, the risk really outweighed the benefit.
OK. So aspirin wasn't good for preventing stroke.
It wasn't good for preventing stroke.
So, Jacqui, if we've shown that aspirin wasn't doing people any good in this study, was it actually doing them any harm?
Unfortunately, it was. The bleeding was, unfortunately, in the brain, in the various compartments, and also the gut. The combination of those two things made it not a good thing to do. So if you're over the age of 70, you're otherwise healthy, there's no real evidence you should take aspirin.
And that's a really important point, isn't it? Because there are older people taking aspirin because they thought it was a good idea. So probably for those people, they should pop down to their doctor and just check and maybe think about that. So can you tell who should be taking low-dose aspirin these days?
Well, I think there's not a shadow of doubt for those people still who have a minor stroke, a transient ischemic attack, a heart attack. These are the people where given aspirin almost straight away is enormously beneficial.
So people with previous ischemic stroke, transient ischemic attack, people with serious heart conditions, stents, that sort of thing, should be on aspirin.
They should take aspirin very early on, and they should continue to take it ad infinitum.
So if you're a healthy person and you're 70 or older, you don't want to get a stroke, taking aspirin doesn't get work. So what should people do to reduce their risk of stroke?
Very good question. So you should really address the things that are likely to cause stroke. And number one is you're getting older, you can't do much about that. Number two is if you develop high blood pressure. If you control your high blood pressure incredibly well, massively reduces the chance of you having a stroke. If you're a smoker, of course, don't do it. Again, reduce the chance enormously. If you're diabetic, if you control that incredibly well, you reduce the risk. And the last one, and probably even one of the most important one, is so-called atrial fibrillation, which is an irregular pulse. So if you happen to be sitting there and you feel your pulse and say, gee, that's jumping around a bit, go to your doctor.
Yeah, really, really important point.
Really important point.
Because something over 10% of older adults will get atrial fibrillation at some point, and it's a huge risk for stroke.
That increases 5 times the risk of you having a stroke. And it's so easy to fix. You can reduce with medications the chance of you developing a stroke if you've got that irregular pulse by up to about 60, 80%.
Now, tell me in that case, if we're not going to take aspirin, what do you see as the future in stroke prevention? Is there anything fantastic coming along?
I think it's going to be all about identifying risk and then controlling risks. There might still be risks that are controllable we haven't fully discovered. And there are others like stress and lifestyle changes that we know you need to control a lot better. So focusing on those sorts of things are going to be, I think, the way of the future, rather than some magic bullet that lazily we just take and it takes away the risk. It's the message again and again, it's just such common sense, is if you lead a healthy lifestyle, the likelihood of you becoming ill is so much lessened.
That's such a good piece of advice. Professor Jeffrey Donald, thank you so much for coming on the show.
Nick, thank you for having me.
Jack, what do you like at night time when you go to bed? Are you someone that ruminates over a conversation or an anxious moment that might have happened during the day?
All night, every night. I do not sleep. We've talked about sleep problems. That's one of the reasons I don't sleep well. I think about everything everyone says about me all the time. It's really bad.
Must drive Beck insane, because the moment my head hits the pillow, it's lights out within a second.
I am not surprised.
Maybe no conscience potentially might be the issue there.
Darcy, this is actually a full thing. We think so much about the conversations that we've had with people and we overanalyze it all. hospital, we actually come to this conclusion, which is false, that people don't like us as much as they really do.
Jack, you're not going to believe this. We actually have some research. A team of psychologists have spent over a decade studying whether or not the predictions in our mind about whether or not people actually like us or not are true.
Well, that's right. And we actually focus on the negative aspects of the conversation rather than the positive. And that's because we overanalyze every single thing that's said to us and we don't focus on the good things.
And we underestimate how much people actually like us, which is the good news story.
We all do that.
It's something to think about. Tell you someone we all like. He's up next and about to tell us all about the appendix.
You probably know that some books contain what's called an appendix at the end, which contains important information that's just not needed in the main text. It's named after the Latin word appendere, which means to hang on to. So the appendix literally hangs on to the end of the book. Now, the other appendix that I'm sure you know is the one in the human body, and its proper name is the vermiform appendix, meaning literally worm-like hanger-on, which sounds a bit creepy, but it actually describes it very well, because the human appendix is a small, wiggly, worm-like tubular structure about the size of your pinky that's stuck deep inside the abdomen on the right side. And the first most of us know about our appendix is when it gets infected and we develop appendicitis. Classical appendicitis starts with a kind of vague central tummy pain, which rapidly gets worse, moves to the right side, and then is associated with nausea, vomiting, and often fever. And if it's left untreated, appendicitis can lead to rupture. So when we diagnose it, we normally recommend surgery right away. The commonest time when people get appendicitis is between the ages of about 10 and 30, but the lifetime risk is actually surprisingly high, with about 1 in 12 of us developing it at some time in our lives. And that's why some people who are going to be a long way from medical help are recommended sometimes to have what's called a prophylactic appendicectomy, or appendectomy, as the Americans call it. Think astronauts who are going to be in space a long time and some polar explorers. In fact, there's a town in Antarctica that's so remote, Via las Estrellas, town of the stars, that before you're allowed to live there, you have to have that little wormy thing removed. Now, it wasn't a big deal for Russian GP Leonid Rogozov. He was the only medic on a 1961 Soviet expedition to Antarctica when he developed, yes, you guessed it, appendicitis. Now, Leonid had had a little bit of surgical training, so he took the only option available. Squirt of local anaesthetic, a mate holding a mirror, and he whipped out his own appendix. Stitches out a week later, back to work soon after, no problem. When I was a medical student, I was taught that the appendix was a redundant organ, so it didn't matter taking it out. And while it's true that people are mostly fine, we now know that the appendix plays an important role in our immune defences, and it also may act as a reservoir of healthy bacteria to help top up our precious gut microbiome. So it turns out that while our human appendix may not be essential, it is important after all. Hang on, just like the appendix to a book.
Well, Darcy, it's hard to believe given the glorious sunshine we have today, but winter is just around the corner. And, you know, this year I'm determined not to hate on winter so much, you know, because it brings so much beautiful, cosy things like open fires, big, beautiful, warm soups, you know, birds. There's great things about winter.
I actually like the change of season, Jo, and I like to get in a sauna in winter time. Now, is that on your list of things that are out?
Absolutely. You know that. I'm not into steaming hot saunas. I love a steaming hot shower, though, although I try to conserve water, so I try to limit my time in the steaming hot shower.
Well, there's some good news on that. I'm a bit the same. I do a lot of my thinking in the shower, but powerful showers can conserve more water than actually sitting underneath a gentle dribble, which is good news for those of us who like a long shower.
Yeah, absolutely. And it's a simple reason people turn off a high-pressure shower sooner than one with low water pressure.
Jo, they tell me the average shower goes for 6.7 minutes. How do you go on that front?
I feel like I'm pretty good. I reckon I'm a 4 to 5 minuter. However, I have been known to have up to 3 showers a day in winter because it's the only way I can thaw out. However, I would have a steaming hot shower way before I would have a freezing cold bath. You know that.
Yeah, I've seen you in a freezing cold bath, Jo, and it wasn't pretty.
We have done an ice plunge together. It was quite bonding. But here's Luke Hines, who, unlike me, is not afraid of an icy dip.
For a lot of people, sitting in an ice bath has extraordinary benefits. Reduces inflammation, boosts energy, and some reckon it can even help you sleep better. It gave me an incredible hit of vitality and, would you believe, shifted my mental state. I felt like I could do almost anything, which is why I'm intrigued to find out if cryotherapy can deliver the same results. How does cryo differ or compare to ice therapy and ice baths?
Yeah, so it's all cold therapy. I think that's one of the things that we always like to stress. There's just a range of cold therapy. So say an ice bath. The advantage we have is you don't get wet. And if anyone's ever tried to get in an ice bath, that is a mental challenge of its own. And you would probably need to spend a good 10, 15 minutes in an ice bath to get the same benefits we get in 3 minutes.
Is there anything I need to do in the lead up to a cryo session?
The things what we try to avoid, we try to avoid moisture, because that is at minus 110 is not a good thing. So what we do is you wouldn't want to come for a run, turn up here and then go into the cryo. You could be a bit crisped by the time you get out. And we avoid any kind of lotions or anything like that on the body.
This is my first cryo. I've done cold water, I've done ice, I've never done cryo, so I'll be honest, I'm a little bit nervous. How does it actually feel?
How does it feel? Well, what generally happens, people go in there initially, your fight or flight system will kick in, effectively. The body will say, you are actually trying to kill me, what are you doing? It is one of those states where if you stay in that highly stressed state, you've just got a lot of the more negative hormones being released. If you can bring yourself in to the rest and digest, you will relax. When you relax, you just get a lot more of those nice hormones that we want to get released in the process, and your mental state will be a lot better. We also see that people sleep a lot better after having had a cryo if they can bring themselves into that nice state. The research on it shows that, particularly in sports, you can reduce the amount of cytokines in the blood, which cause inflammation. There's a lot of research as well around brown fat production, or turning some of your fat into like brown fat, which is thermogenic, which is actually really beneficial for your metabolism. And there's some really interesting information around dopamine coming out. And so raising your dopamine level, but not in that kind of sugar rush type way, but in a really sustained way so you can take that through the day. And we do have people that come in the morning just to get that so they can focus for the day. We get a range of people and they are looking for different things. So we do get professional athletes and they are really looking for that recovery aspect. We're getting, I think, weekend warriors, people like myself, I guess, who do powerlifting but kind of take it a bit seriously. And we get people who've got chronic pains and arthritis and things like that, and they use it because they get a benefit, they definitely get a benefit from that.
How will I feel straight after my cryo?
Generally, people are very excited when they come out. Partly relieved, partly excited. You do get a big dopamine rush because that is what's being stimulated. And also when you walk out, because your body brings all the blood to the organs during that time you're in the cryo, all that's getting released, so your body just feels really invigorated.
Okay, wow. I deliberately didn't have a coffee today to see how I would genuinely feel with no other stimulants in my body. Now, if you are someone like me who can get a little bit nervous about things like this, I can tell you, hand on heart, give it a crack, because that right there was the best energy-giving, life-inspiring, day-motivating thing you could possibly do. It is brilliant. You have to give this a go.
I'm about to go on holidays, I'm about to pack, and I have a lot of makeup. What do you pack? 3 things to ask yourself.
Where are we travelling to?
what will we be doing when we're there? Dinners or swimming a lot? And thirdly, what would we like our outcome to be? I think it's all about how you pack it. So deep hot where you can. I would go for creams over lots of powders as they can often shatter. Do you have a really good palette that has a bit of blushes, bronzer all in the one? Bring that. It's flat and it's better than bringing a million blushes and bronzers. The key to hitting the ground looking glam is 2 or 3 things: concealer, bronzer, blush. That's it. If you've done all your hydration on your flight, being from Australia, it's going to be a long one. Then you have locked in all that glow and you're looking healthy. It's just a little bit of makeup. There's no reason to step off with a full face, but you do want to look like you, but in HD. I would say your skincare routine is actually even more important when you're traveling. We are running around, walking a lot more, flying, so everything is going against us. Skincare items I would bring, SPF obviously #1. I then would go for some kind of like spritz or mist, anything that locks in that hydration, sprays, moisturizers, all our skincare. Hair products, if you can fit them in, definitely. I would go for a leave-in conditioner. It really locks in all the hydration you lose in the pool, at the beach, and the sun. You are not allowed to pack any more than 2 hot tools. I would be prepared when traveling, so buy the majority of your products before you leave. And my favourite section when you walk into the chemist is the miniatures. So all the brands we love, but available in a mini size, which is great. Pack it in, it doesn't take a lot of space, and you also have it for when you arrive. A little bit of planning at the start before you leave will ensure that while you're on your holiday, you can enjoy it and look good.
Most of us know by now, Dr. Nick, that pregnancy and alcohol do not mix, but it used to be thought that the occasional glass of wine was okay during pregnancy, but now not so much.
Yeah, it's a no-go zone these days, Jack. So the rule is if you're pregnant or trying to get pregnant, no alcohol. We know that really heavy drinking during pregnancy causes things like prematurity and risks damage to brains, other organs. Now, I don't want women who've had the occasional glass to get overly anxious, but we just don't know what the safe level is. So the advice is none.
Alcohol companies were given until July last year to put alcohol warning labels about pregnancy on their bottles, so you should really see those popping up by now.
Well, you should, Jack, but yeah, sadly at the moment not enough, because the rule is that any beverage with over 1.15% alcohol should have a label. But some of the companies are opposed and they're really resisting this change.
Well, they certainly are resisting. Just 0.1% of the more than 8,000 bottles tested actually had those warning labels.
So in case I didn't make it clear last time, Jack, the rule now is no alcohol if you're pregnant or trying to get pregnant. It's a bit like what we eat. I mean, things like oysters and soft cheeses, you may love them, but if you're pregnant, they're off the menu, so is alcohol.
Well, we're always striving, Dr. Nick, to have happy and healthy children, and nowhere more so than at Melbourne's Royal Children's Hospital, where they're looking at bringing childhood cancer back to zero.
To my knowledge, no country in the world is doing this. Very exciting.
Paediatric oncologist Professor David Eisenstadt has every reason to be excited. He heads up the Zero Childhood Cancer program for the Murdoch Children's Research Institute.
Zero childhood cancer is a form of personalized or precision therapy or precision oncology, in that we want to, in some ways, find the right drug for the right form of disease for the right child. That's not that simple. But with these technologies, it's not only feasible, but it's happening.
Thanks to technology and advancements in genomic sequencing, Dr. Eisenstadt and his team can determine the specific cancer-causing genetic alteration in children with high-risk cancers and then target it with a specific drug. The results speak for themselves, an increase in the survival rate from 30% to 70% in children with highest risk cancers.
Overall, if you take 100 children with cancer, our initial cure rate or 5-year survival rate is about 83%. So if you break that down, some of the cancers, for example, Hodgkin's disease or Wilms tumor, which is an embryonic cancer of the kidney, have cure rates over 95%. That's outstanding. However, we have other cancers, such as a tumor called the diffuse midline glioma, with just 0% survival. And I've been in the business 30 years, and those diffuse midline glioma patients, we have absolutely made zero progress.
Almost 2,000 children have been sequenced so far, and with around 1,000 kids diagnosed with cancer every year, the Zero program not only hopes to prolong lives, but also collect valuable genomic information.
So one of the things that are running in parallel with these sequencing efforts for identifying targets for treatment is to also look at children who are actually at risk to not even do well with the therapies for reasons you wouldn't expect. One is that they metabolize the drugs too quickly, and so they don't stick around long enough to work, or they're at very high risk for very bad toxicities. So we don't want to just cure the child, we want to get them into adulthood and healthy. And then the final thing that's really important to note is that very few drugs have been developed specifically for childhood cancers. And so with our group collaborators at the Hudson Institute, working with our Zero colleagues to perhaps identify drugs that could be repurposed, or taking novel compounds that aren't quite yet drugs and modify them for use in the childhood cancer clinic, rather than go through the usual 10 to 20 year cycle where it's tested in adults and gradually trickles down to children. So it's another exciting area. So these are all happening at the same time.
Initially, the treatment was only available to children with high-risk cancers. But now kids across the country at all children's hospitals will have access to Zero.
I would say here in Australia and New Zealand, children are very lucky to have access to this program, which is really rather unique compared to other countries internationally, that every child with diagnosis of cancer will have the tumor sequence, their blood sequence, and will learn about potential risk factors for not responding to standard therapy, or identify actionable targets for which we can select drugs and then treat children. So it's a fantastic opportunity.
The world has blessed us with many different and exciting ways to move our bodies, many of which I have tried and tested on this very show. But regardless of your exercise of choice, a consistent requirement is maintaining muscle health, and the nutrient for it is magnesium. The fourth most abundant mineral in the body, magnesium is mostly known for its role in supporting healthy muscle contraction function and assisting with muscle relaxation. But beyond this, it also assists with energy production and nerve conduction. Even healthy sleeping patterns may be supported by magnesium when dietary intake is inadequate. Despite its importance, our lifestyle choices may have an impact on magnesium levels. A poor diet, increased coffee or alcohol consumption, prolonged stress, or strenuous exercise all deplete magnesium. But unlike other nutrients, our body may show signs when we're low, as muscles cramp or experience mild spasms. The good news is magnesium can be found in many food sources, including green leafy vegetables such as spinach, plus nuts, seeds and whole grains. Even my own personal favourite, dark chocolate. We can also explore magnesium in supplement form. Fusion Health Magnesium Advanced is infused with 4 different types of magnesium, including magnesium glycinate, an organic form with more bioavailability than other inorganic sources. While the various nutrients in the health space can take some learning, you don't have to be an expert to understand their benefits in keeping us moving. It's goodness for the body and mind.
Thanks to Heinzie there, especially for the encouragement to eat dark chocolate.
Don't need that.
No permission needed here for me either. Now, Jack, it's mushroom season in many parts of the country, which goes right through until June. Mushroom foraging is all over social media, but it's also a time when hospitals see a spike in poisonings in people who have picked and eaten the wrong type.
Joe, the Australian Food Safety Information Council has actually taken the step to warn everybody not to forage for any wild mushrooms, even if you think you know what you're picking.
Yes, because mushrooms are very clever. They can look like one species but actually be another.
Amazing.
And experts are particularly concerned about the rise of online posts from foragers who share photos of mushrooms they've picked and then they ask the internet to identify them. This is never a good idea.
Absolutely not. Clearly, the only safe way to eat wild mushrooms is if you purchase them from a supermarket or grocer. But here is another very safe plant alternative. Here's Zoe to give us the lowdown on chia as your mealtime champion.
They might be small, but chia seeds are mighty in the health game. And that's why I'm using 2 types today in my fresh coconut chia bowl for double the goodness. Coconut milk, chia seeds, and fresh shredded coconut over heat helps to create that thick, creamy texture. 3 to 5 minutes will do the trick. If it gets too thick, just add a little water. Look for translucent chia seeds. That's how you know it's ready. Chia seeds are one of the few plant sources of omega-3 fatty acids. That's why I put them on and in everything. While this mixture's cooling, it's time for part 2. Puff chia with raw nuts packs a punch of crunch to balance the velvety pudding. Honey and cinnamon deliver the flavour factor. It's lightly sweet, but with warmth and depth. The beauty is all in the layering. I'm using banana and blueberries, but any fruit will work. This dish is giving off dessert vibes, but it's packed full of nutrients. And look at it. It almost looks too good to eat. Oh, I did say almost. Get Nourished is brought to you by Swiss Ultiboost High Strength Krill Oil, a premium quality, sustainably sourced formula to relieve knee pain and stiffness in mild to moderate osteoarthritis and support heart, brain and eye health.
Well, earlier we saw Luke Hines plunge into the freezing world of cryotherapy to discover the healing powers of cold therapy. Well, in the Northern Hemisphere, winter has officially ended, but they recently had an exhibition there that celebrated the magic of snow.
Yes, the 2024 Snow Sculpture Championships, say that 10 times fast, is on in Colorado, and teams converge from around the world. They get these 25-ton blocks of ice and they carve them into amazing sculptures.
Jack, no power tools allowed, only creativity and hand tools. The teams work for 94 hours over a 5-day period, and the masterpieces that they create form this beautiful outdoor gallery in the ski resort town of Breckenridge.
Yeah, and this year's winner was a piece called The Beggar by Team Mexico. The silver award went to Team Mongolia with a sculpture called Mother Earth. I don't know if you've seen them. They are breathtaking.
It's genius, isn't it? And on that very icy note, that's all we've got time for today. Thank you to Joe, to Jack and to Dr. Nick Carr.
Check out House of Wellness Radio with Luke Hines and Gerald Quigley every Sunday.
Big thanks, as always, to the team at Chemist Warehouse. It's bye for now.